Welcome back to Insight. It's open enrollment period now for your health insurance, and the state of Indiana has actually got some help for all of us. Well, most of us. I don't know. We're going to find out, Fred. That's what do we want to find out about State Health Insurance Assistance Program, otherwise known as SHIP.
That's correct.
So explain.
Basically, it's a free program. It's offered by the Indiana Department of Insurance. They are funded by Medicare, and then they train all of our SHIP volunteers around the state of Indiana. We have roughly 300 around the state. I am located in Allen County. We have 3 locations in Allen County. We're at Parkview Hospital, we're at St. Joseph Hospital, and we're at the community center. But there are also counselors in most of the 9 Northeast Indiana counties, for example, in DeKalb County and whatever.
So it is county specific.
It is county specific, although we can help anybody. In fact, I talked to a gentleman from California yesterday who was going to move to Fort Wayne, and he wanted the information about what was available in Fort Wayne. So if somebody either calls from out of state, we can help them, or if somebody from one of the other counties outside, if they'll call our number, we can hook them up with somebody that's local as far as they're concerned.
What are the questions people are asking?
The main question this year, or not this year, but right now is, as of September the 30th, everybody who has a a Part D plan should have received what's called their annual notice of change. And right on the first page of that, it tells you if you have a premium, what your premium is going to be next year. If you have a deductible, what the deductible is going to be next year. What it doesn't tell you is how much your drugs will actually cost. And that's what we can do for the folks. If they will bring their drugs in, and we can compare, and we can actually tell them what their drugs would cost next year if they keep the plan, or if they want to go to a different plan, and then they can sign up for that, and it'll start on December 1. And I had 3 clients yesterday, and 2 of them, they were very, very happy with their plan. And we had a 3rd one, and we found a plan for her that next year she could save $500 on her drugs.
So is it Medicare only that we're talking that are coming in and talking to you, or is it
Medicare? We're Medicare. We do not get involved, for example, with the Affordable Care Act or any of that. Those are other volunteers or other people that work with that. We're trained by the state in Medicare-related items. In Medicare, and for people who might be in the lower income brackets, we can help them possibly find some help with their health care costs as well.
So how much longer then is this help available?
We're available all year, but the open enrollment period only lasts until December the 7th this year. So people still got another few weeks when they can look for the program that might be best for them. And in addition to that, of course, for people who don't have Medicare yet, if you're going on Medicare, we are able to tell you what your options are, because when you do go on Medicare now, it can be very, very confusing. If you're getting close to your 65th birthday, you're probably getting all sorts of mail of people that want you to buy something. And we are totally unbiased. We don't recommend plans. We can't sell any plans. We just lay out the information so that the people can make their own best informed decision for their health care.
And the help is set up a meeting, or am I actually getting the help over the phone?
We can answer questions over the phone, but for people who actually have a drug list or whatever, then we can actually put their drug list in and show them how to navigate the Medicare website as well.
Pretty cool. It's a free service. It's called SHIP. If you'd like more information, they've got a great website there. They've also got that phone number. If you'd like to reach out and call 373-7952. We'll be right back on Insight.